you so much for that incredible introduction. And most of all, thank you for your leadership. I'm so excited that you are going to be the next president of PNHP. Let's give it up for Diljit. I also want to thank outgoing President Phil Verhoff for his steadfast leadership. It's been such a joy to work with you. And I want to give a special shout out to the PNHP Advisory Board and also our Washington State PNHP Chapter Chair, David McClanahan. And all the people in the house from Washington State, you get a special shout out tonight. It's really wonderful. I also want to congratulate all the awardees. It's so inspiring to hear about the work that you all have done and just to know that your leadership is here. Also, I have just loved meeting all the students that I've had a chance to say hi to tonight. So special shout out to all the students who are here tonight. You give us so much hope. And you're right, it's not just that you're the future, you are the present. And you are making such a difference. So thank you so much. I'm really grateful to be with you tonight and to have PNHP and all the entire coalition of organizations as such a key partner in our fight to reform our broken healthcare system and fight for a single-payer system. Your work on the ground to organize a bigger movement for a single-payer healthcare system has been absolutely critical to all the progress we've made. I'm an organizer, for those of you who know me. 20 years before coming to Congress, I was an organizer on the outside. Now I'm an organizer on the inside. I feel like it is this work on the ground that actually makes a difference. And your engagement and your commitment to speak up clearly at our press conferences, in events, in Congress, about what it means to be a provider in a broken healthcare system, how difficult it is to do the real work of real medicine that you all signed up for, has really helped us to personalize this, to tell the stories of people on the ground who deserve healthcare and aren't getting it, and the providers who deserve to be able to provide it, and yet you're coming up against all these barriers. So thank you so much for all of that work. I want to take a couple of minutes to talk just about some of the wins we've had, and Diljit mentioned some of them, but I think it's important as organizers, I find anyway, that we always are on to the challenges. We don't really celebrate the wins. And I think it's important, given that we're going to be moving into a very challenging environment over the next several years, that we just take a little bit of time to celebrate you all and to celebrate the work that we've been able to do. Particularly, I want to talk about the entire single-payer coalition focusing effort on stopping the privatization of Medicare. We know that this is one of the biggest threats to any progress towards a real universal healthcare system. Just destroying Medicare without people even really understanding what's happening. And that's how I think about all of these programs that you all have been helping to fight back against. We've had some real collective successes in our work to end the direct contracting program, a major threat to traditional Medicare coverage, hidden in layers of bureaucracy, as well as our work to significantly roll back the subsequent iteration of this, which was more gently called the ACO REACH program. You worked, as Diljit said, very closely with us to promote your important research. In my letter with Senator Warren to CMS Administrator Brooks LaSure, calling for an end to the ACO REACH program and highlighting just how corrupt a program it really is shaping up to be. And at the beginning of President Biden's first term, you all worked with us as we led what I think is probably the most successful push we've had on Capitol Hill to really push back against what I call Medicare disadvantage. I don't call it Medicare Advantage, I call it Medicare disadvantage, because we don't want people to think that this is an advantageous system. It's not. It really draws people in, promises them things, and then doesn't provide it, and makes a lot of money in the process. For the first time in Congress, we were able to stop the private insurance companies from being able to send the letter that they send every year with many members of the Progressive Caucus, by the way, We were able to stop that by doing a whole set of panels on Medicare Disadvantage, on the profiteering in it, on what was happening. We brought in experts, and it was a fantastic opportunity and a really deep conversation that led to us then being able to stop the letter that they normally send, the private insurance companies, and then push the letter that we were able to send and get 60 members of Congress, which, you know, is a big number in Congress, to get 60 members of Congress to sign on. And that's not to mention all of the work that you all have done on our North Star of Medicare for All. I am so proud to be the lead sponsor of Medicare for All. It is really, truly one of the joys when I was, I came out very early for Bernie Sanders in 2016 and then was his health policy chair in 2020. And Medicare for All has been my North Star in terms of really thinking about what we need to take care of ourselves as individuals and as a country. And just think, in the last 2 years alone, thanks to your work, I counted, if the website is correct, you can correct me if it's not, but I counted 19 local jurisdictions have passed resolutions calling for Medicare for All. From Texas to Ohio, Florida to Maryland, New York to California, Massachusetts to Colorado. And it's really been fantastic. And this Congress, thanks to the work of so many in our coalition and our inside organizing, we had 113 co-sponsors on the Medicare for All bill. That is more than half of the Democratic caucus. And we were actually able to keep the same number of members of Congress on the bill, even though we had a smaller minority than we did a majority in the Congress before. Now, since I became the lead sponsor of the improved Medicare for All bill in the House back in 2018, we've also continued to make progress on just moving the conversation within Congress. We held the first ever powerful hearings on Medicare for All. God bless Adi Barkan, who was just so incredible at those hearings. And every year, we're able to get more and more sponsors on the bill. I also set up a Medicare for All caucus, and we've used that caucus, including during the pandemic, to bring experts from all over the world to talk to members of Congress about healthcare systems in other parts of the world. It is not inconceivable. It is not crazy. This is many countries around the world that are in our economic conditions, are able to pass a universal healthcare system. And so it was really important for us to be able to do that and also to have shadow hearings of the impact of our broken healthcare system in that horrible pandemic, where we lost so many people and such a disproportionate burden on people of color and poor people in this country who died at such disproportionate rates. Even under a president that was not for Medicare for All, we worked collectively to build support for expanding Medicare as one strategy to getting to Medicare for All. So finally, dental, vision, and hearing actually made it into a bill thanks to the Progressive Caucus that held the line and passed Build Back Better through the House of Representatives. Now, unfortunately, the Senate couldn't pass it, despite the support of 99% of Democrats in the House, the Senate, and the White House. But the fact that we got it into legislation, passed it through the House, is actually really, really important. Also, one of the most popular economic proposals of the Harris-Walz campaign, as you might recall, was the addition of a long-term care benefit into Medicare. And every room I went to when I was in swing states for the 8 weekends before the election, every single weekend in a different swing state, and every room I went to where I mentioned that, the room went crazy with cheering and applause, because everyone is dealing with, in different ways, how to take care of their most vulnerable, their elders, their loved ones, and recognizing that it is incredibly difficult to do that, to have that care, to have that economic ability to do that. It's worth remembering that it was only 6 years ago when I took over the Medicare for All bill that we were actually able to even introduce long-term care into the Medicare for All bill. That was the first time that Medicare for All included long-term care. And I think it's really important to think about the fact that for such a huge program to make it to the mainstream Democratic nominee's presidential campaign in just 6 years is a remarkable thing, and you deserve a lot of credit for helping us get there. On the electoral side, it occurred to me that we need more incentives to help candidates who are running for office be comfortable embracing and fighting for Medicare for All. And so I set up a Medicare for All PAC several years ago that's funded by small dollar donations. And because of that, I've been able to help provide funding for candidates in their campaigns to actually embrace Medicare for All. And because of that, we've had a number of frontline candidates, people who run in the toughest districts across the country, who have actually embraced Medicare for All, have signed on to the bill, who talk about it over and over again. And I think that has been really important. And through the PAC, we worked with experts in California, maybe some of you are in the room, to nationalize the Medicare for All calculator, which was developed in California, to help make it so that it could be used anywhere in the country, so that when you're talking to people, you can pull out your phone and you can actually show people what they would save if they went on a Medicare for All program. So I hope that you will take a look at that calculator if you're not already using it. It's a great tool to be able to have a conversation with people about what they actually pay right now and what they would pay under a single payer system. So these wins are slower and smaller than we all would like. But that's good because we're visionaries and we don't get everything we want the next day. But we know how to work for it. That's what organizing is. And so this work that you and the entire coalition of single-payer advocates have been doing are really the reason that we have made this progress. And before we get to the election, I want you to remember that and give yourselves a huge round of applause because those are big victories. Of all the rooms in the country, this is a room that understands how badly we need single-payer health care. You are on the front lines. You see it every day, and I am so grateful for that work. You are in this broken system, trying to provide care, trying to take care of people. Just imagine this. The average premium for single coverage has gone up 25% in the past 5 years. That's at a higher pace than inflation. The average family is paying more than $25,000 per year on their premium. That is 24% higher than it was in 2019. All of the subsidies that we in the government have endeavored to provide to make healthcare more affordable have certainly helped to lower the cost of premiums for the most vulnerable, but that is a relatively small group of people in the grand scheme of things, and those subsidies have gone into the pockets of the private insurance companies who then raise the premiums for everybody else. So they still make the same amount of money or more even though we're providing these subsidies. Today in the United States, half of all adults say that they find it difficult to afford the cost of health care. And 1 in 4 have skipped or postponed coverage because of the cost, with sometimes life-threatening consequences that you see every day in your work. In fact, while we're covering more people than before, thanks to some of our efforts as Democrats in Congress, the underinsured is the new giant category of uninsured. And I said this morning on television on MSNBC. If you heard me, I was making this point that we have, yes, we can say that we're covering more people in the United States, more people have health insurance. That's a good thing. But the people that have health insurance are still not getting the health care they need. They are underinsured. They're still using GoFundMe campaigns and other ways of raising money to pay for health care. Our choice, and it is a choice, to remain as the only major country on earth not to guarantee health care for all means that 85 million Americans are either uninsured or underinsured. And we now spend twice as much per capita on health care than virtually any other country. While 1 out of 4 Americans cannot afford the life-saving medicine their doctors prescribe, in 2022, 10 of the top pharmaceutical companies in the United States made over $112 billion, billion with a B, billion dollars in profits, and the top 50 executives in these companies made a combined $1.5 billion in total compensation. Yeah, you can boo. Yeah, big boo, big boo. Yeah, exactly. Let's just be very clear that the only people that are benefiting from the status quo are the private, for-profit insurance companies, big pharma and medical equipment suppliers who then spend billions of dollars in our election to ensure that the system stays in place while sacrificing the health, well-being, and lives of hundreds of millions of Americans. Shame. We know, this room certainly, but even the country knows that Medicare for All would save the American people and our entire healthcare system $650 billion each year. And that is according to the Congressional Budget Office, who actually looked at this and evaluated how much we would save if we moved to a Medicare for All system similar to the bill that I lead. That would also improve the economy. It would eliminate all out-of-pocket healthcare costs. And so the question really is, we know where we're trying to go, but how do we get there? Especially given what just happened in the elections last week. Donald Trump's sweeping electoral victory to become our next president and the serious challenges before us with the what is going to be a Republican trifecta in the White House, Senate, and the House are going to be a massive step backwards, and that's an understatement in every possible way. I don't think I can fully envision what that is going to look like, even though I already went through 4 years. I was elected the same night as Donald Trump was elected in 2016, and I remember being very nervous about not knowing what to do as a member of Congress, having a bit of like imposter syndrome as I came in as the first South Asian American woman and one of only 25 naturalized citizens and one of only 87 women of color to have ever served in the United States Congress since the history of our country. And the first thing that I did was respond to Donald Trump's Muslim ban. And I got myself a bullhorn and went to the airport and gathered up a bunch of my organizers, and we had 500, 600 people at the airport, and I threatened to shut down the airport if we couldn't bring the plane back from the tarmac, which was going to deport people simply because they were Muslim. And I thought, well, I know how to do this. This is just organizing. So look, we've been through this, but these are going to pose big new challenges. Trump's Project 2025 clearly laid out their plans to privatize Medicare, to, quote, restructure HHS and CDC, to add work requirements to Medicaid, to further strip reproductive health care, among many, many horrible things. And if their plans come to fruition, our already broken healthcare system will crumble, and everyday people will bear the burden of that. So over the next several years, our work will necessarily and importantly be to stop the worst of what is happening, if we can. I want to be clear, we may not be able to. We're not going to have the House, even though it's going to be very, very close. Those numbers are still out. I think we could be at 214 or 215 for Democrats in the House, which means that Republicans would only have a 2 or 3 vote margin at most. And because Donald Trump has nominated a couple of Republicans to be in his cabinet, it means that they will lose those people, and we might have 3 or 4 months where those seats have to be filled, where we will literally have an equal number of Democrats and Republicans, or just a very slim majority. So there will be some time at the beginning of next year in particular where there may be some opportunities and certainly some big fights. We are going to have defensive fights to fight against the worst things that come up, and there will be moments when we can use those fights to highlight our vision for progress for Americans to be able to get the health care they need, and contrast that against their vision of providing tax cuts to the wealthiest billionaires, the biggest pharmaceutical companies, stripping health care away from people. That's the contrast we're going to have to really lean into and make in those moments. And that will come up with the tax fight around April of next year when they try to extend Trump's tax scam, the big tax cuts that they passed in 2017. Now, at the same time, we need to do the hard work of rebuilding the Democratic Party so that we are clear about what we actually stand for and what and how we intend to deliver to working people and poor people across this country if we get chances at the majority again. Our values should drive this. How we help Americans have trust in us again. How we become the party of peace again, not war. And yes, how we ensure that people have fair wages and benefits and rights on the job and health care. This is also a time that I think we need to use to educate the American people about what our vision is for a healthcare system that provides universal and comprehensive care and puts people over profit. That education will be absolutely essential to withstanding all of the attacks that I'll talk about in a minute. Now, the good news is that the election did show us that people are not rejecting our populist, popular, progressive ideas. In fact, just witness the fact that in several states that voted for Donald Trump, voters went around their Republican legislatures and they passed minimum wage ballot initiatives, right? Raised the minimum wage to $15, which I feel very proud about because Seattle became the first major city in the country to pass a $15 minimum wage. That was 10 years ago, and I was on that committee that did that. Also, in those same Trump states, states that went for Trump, voters went to the ballot and passed paid leave as well. Very popular across the country. And of course, in 7 states, including 4 states that went for Donald Trump, it would have been 5 if Florida had been a simple majority, voters passed abortion access. And we did still elect Democratic senators in places like Arizona, Michigan, Wisconsin, and Nevada, even if we lost the top of the ticket in those places. And in the House, we're adding to our ranks a fabulous, great incoming group of 9 new progressive members to Congress. I hope you check them out. They're really fabulous, fantastic, inspiring. Another proof point is the polling that my Medicare for All PAC did in a number of battleground states in late September. We actually initiated this polling because we were worried that with the Vice President coming in and her past support for Medicare for All, that people would start attacking Medicare for All. And we wanted to figure out what are the most compelling arguments we make in swing states against some of those attacks. And so just 6 weeks before the election, we did this polling. And the results we got, I'll share a couple with you tonight, are really important for our strategy moving forward and our organizing. So we polled likely voters in 7 decisive battleground states of Arizona, Georgia, Michigan, Nevada, North Carolina, Pennsylvania, and Wisconsin. What did we find? Most important, Medicare for All was actually more popular than Vice President Harris in every one of the states. Medicare for All received 55% support, while Vice President Harris received 49% support. The voters in these states who happen to decide the presidential election year in and year out, are actually incredibly hostile to corporate giants who control their health care. Voters rated insurance companies, big corporations, and especially prescription drug companies with intense negativity. In fact, Republican voters gave slightly lower marks to Big Pharma than even Democratic voters did this year, although not by much. Now, in particular, 85% of black voters, 77% of voters of color in swing states support Medicare for All. So many of the voters that Democrats lost ground on this year are strongly in favor of Medicare for all. Young voters from 18 years to 39 years old support Medicare for all at 62%. 74% of Latino voters, 52% of non-college educated voters. So this is really the Democratic coalition as it existed certainly before the results of this election. But even beyond our base, Medicare for All actually received 63% support from voters that describe themselves as moderates and 57% support from those who describe themselves as independents. So I tell you this because I think it's very important to know that we had this support, and I'm going to get to some areas of concern in a second. As expected, existing Medicare and Medicaid programs have net positive ratings amongst all voters across all parties, races, classes, and ages. Battleground state voters also overwhelmingly support a wide variety of policies to expand Medicare and lower healthcare costs, even if they may not be fully there on Medicare for All as a whole. So just imagine, 92% of voters, that's just about everyone. In a poll, you don't get better than 92%. 92% of voters support expanding drug price negotiations for everyone, right? 85% support expanding Medicare to include dental, vision, and hearing. 67% support allowing anyone of any age to buy into a Medicare plan. 66% of voters support lowering the Medicare eligibility age to 60. So the key piece here is that there are all these elements of expanding Medicare towards the goal of Medicare for All that is a really important strategy for us to incorporate and integrate into our organizing. Now, when it came to supporting Medicare for All, voters were most excited, of course, about lowering the cost of prescription drugs and just overall reducing the amount of healthcare spending by eliminating the profiteering of the current healthcare system. The profiteering of current healthcare system really gets to people as we would imagine it would, right? We're putting profits over people's healthcare. And they see it, they know it, they're infuriated and angered by it. And so when you ask people what do they dislike the most, it always comes back to costs. And the most unpopular thing about our current healthcare system is that premiums and deductibles are too high, that they can't afford to pay for healthcare. Now here's the work that we need to do as we design our ongoing strategy and campaign for building support. Surprisingly, I was surprised that most voters are actually largely satisfied with their own insurance policies. And I've got a lot of theories about this, and you probably do too. And some of the corporate brands do fairly well. Believe it or not, people still like United Healthcare. So we have work to do to really explain to people what United Healthcare is and why they should be enraged at United Healthcare, because that is one of the villains in the room along with Big Pharma. Now, in addition, what happened when we tested some of the most common attacks we hear against Medicare for All, support went away like that, very, very quickly. And it quickly took it to under 50% approval. And so we lost a lot of people the minute we just even said some of the lies and attacks that are lobbied against Medicare for All. And so the fluid nature of that support and the ability for attacks to quickly undermine support tells me that we have work to do to actually help educate voters about what Medicare for All is, how it would work, what the components of it are, and why it is not going to be what they are being told by these huge corporations that pour enormous amounts of money into these attack ads. And it tells me that we need to better define who the villains are of our broken healthcare system. So that is some of the work that we are going to undertake, is trying to go deeper into some of these questions so that we can start to do really on-the-ground work with people to figure out how to best talk about this and how to best move some of the attitudes so that when we are pushing for Medicare for All or for any of the components of expanded Medicare, we are actually able to sustain the progress we make. Because so many of my colleagues will tell me, I believe in a Medicare for All system, but I don't want to be attacked by all those corporate ads that come in, you know, tens of millions of dollars of corporate ads or hundreds of millions of dollars of corporate ads. And I think we need to do the work to actually build the resilience of the support for single-payer healthcare. So that is going to be one of the pieces that we start working on, and we will share all of that with you as we continue to do this work, really talking to people on the ground. So let's use the next few years to build this movement in 3 specific ways. And some of this is work for you, so take notes. Ready, Max? All right, because I got some work for the students here. So first of all, we need to continue to run the coordinated campaigns across as many states as we can to educate more and target groups of voters with that new messaging and build that solid level of support. And I think that can be combined with door knocking on the ground campaigns, targeted social media, and other forms of advocacy. And it can be coordinated with your efforts to continue to pass resolutions in local jurisdictions and also efforts that build support for statewide single-payer initiatives. Second, we need to continue to build the support of major organizations, including medical organizations like the AMA, and PNHP and medical student organizers. You guys have played such a crucial role already in bringing the AMA closer than ever, at least by neutralizing their opposition to Medicare for All. Good job, everybody. That was really fantastic work. And I think we really need the medical community because they pour a lot of money in and they influence a lot of folks inside the halls of Congress, unfortunately. And so there are 2 big opportunities to address this, and I think of these as great organizing opportunities for all of you. And I think PNHP is the perfect organization to help lead this work and pull in as many coalition partners as possible. So the AMA Medical Student Advocacy Conference is March 6th to 7th. 2025 in Washington, D.C. I know you've got it on your calendar already. Let's have that be a key opportunity to do advocacy on the Hill, as well as to organize students in preparation to turn out as many people as possible for the AMA, for that conference, and then for the AMA House of Delegates annual meeting, which is June 6th to 10th of 2025, right here in Chicago. You ready for that? All right. Because this is really an opportunity to work towards drafting and passing resolutions to support the work and try to get the AMA, or at least push them in the direction of supporting Medicare for All and opposing our for-profit medical system. Third, we'll continue to do the work to get more and more members of Congress to sign on to Medicare for All, and we'll have a big introduction. I hope as many of you can come and join us for that when we do that next spring. Fourth, let's build support for policies that expand Medicare on the path to Medicare for All. So we're planning to introduce bills for key components of Medicare expansion, like lowering the eligibility age, adding dental, vision, and hearing. That will allow us to get more co-sponsors who might not be willing to sign on to Medicare for All, but they are willing to actually push for these individual pieces. And so tonight is really a call to action. It's a thank you, and it's a let's get to work again. Because these ideas, I hope, will just be food for thought. You'll come up with better ones, more creative ones, or you'll implement some of these in the ways that you see fit. But you play an incredibly important role. And look, I'm not going to lie. This is going to be a very difficult time. I was in the gallery on January 6th of 2021 when the insurrectionists came and they pounded on the doors when I was trapped in the gallery. They had taken all the members of Congress off the floor, but I was stuck in the gallery up above the floor, and I heard the pounding on the doors of the gallery as they were screaming to hang Mike Pence and kill Nancy Pelosi and kill all of us. And I never in a million years thought that I would be coming to Congress to do my job, certify the election for Joe Biden and Kamala Harris, who won the election, and be afraid that I would not make it out of there alive. And so I don't know what the next 4 years will bring. But what I do know as an organizer is that difficult times make good organizers. Strength emerges, in my experience, in the deepest times of crisis. And courage is not doing something when you are not afraid. It is actually doing something despite your fear. And so that's the work we have to do. And despite all of the challenges ahead, I know that this is a room that believes deeply and will work towards universal, comprehensive health care for every single person, for all of the pieces of health care, from reproductive health to long-term care, to no copays, no deductibles, no private insurance premiums, and of course, you know, for everybody in and everybody in, everybody in. Thank you all so much for having me.